According to Becky Cisa, the Health Journalism Institute of the Mail and Guardian, more than half of the Thuthuzela Care Centres are without counselling services or have been forced to rely on one or two social workers to comfort the survivors of abuse after they have lost their funding from major international donors. In fact, under former Social Development Minister Bathabile Dlamini, they report that these centres lost funding for counselling services and no one can say what the future holds. Well, to talk about this and to unpack this, given the scourge of gender-based violence, I'm joined now by the director of Becky Cisa, that is Mia Malan. Mia, thank you so very much for joining us, as well as gender activist Lisa Vetten, who is also serving on the panel that the President has set up subsequent to that gender-based violence summit. Thank you so much for joining us in the studio. Let me start with you, Mia. When Bathabile Dlamini was in charge of social development, what exactly happened to the Thuthuzela Centres? What happened to the money for survivors of abuse, for survivors of rape?
So the Thuthuzela Centres are a project that is managed by various departments. For instance, the Health Department will provide medical services, and Social Development is responsible for the counselling services. Now, historically, the counselling services have been funded through international funding, mostly through the Global Fund for HIV, TB and Malaria.
Yeah.
Because violence makes you so much more vulnerable to contract HIV, they could get money from that fund. So Social Development didn't have to give the actual money itself. But over the past 3 years, South Africa has changed its HIV prevention strategies to so when they apply for money for the Global Fund, not to apply for general HIV services, but to concentrate on those districts with the highest HIV prevalence rates.
Yeah.
So it's only about half of those districts that they focus on now. So that means now that if a Thuthuzela Care Centre is situated outside of one of those districts, there's no Global Fund money available for it. And the Social Development Department, because it's responsible for these counselling services. Many of these NGOs that provide the counselling services that got funded for it now thought that Social Development would fund them for it. And it's not an unreasonable expectation. At the Gender-Based Violence Summit last year in November, President Cyril Ramaphosa specifically said that he would make more money available for these centres, and he reiterated that commitment at the State of the Nation address in February. But when we called the President's office, the spokesperson said that the President expects the departments who are responsible for the funding to follow through themselves.
Yes.
Now, as we know how funding is structured, it's provinces who would have to give that funding. And we've tried to get hold of the Social Development Department for 2 months. We tried 3-4 times every week. We've had no response to tell us what is going to happen. And the NGOs now also don't know what is happening. And we've spoken to various NGOs now. Our reporter, Nalisiwe Masomi, did the story. And they stuck without anything. To give you an example, in Limpopo there's an NGO that has, over the 3 years that they received funding, provided 20,000 victims with support. They on average saw about 500 people a month. They now can't even see 100 people per month. And their counsellors are sleeping in the office because they don't have transport money to go back and forth to home. In Sasolburg, they drove to the Social Development Department, the director of Lifeline, because they didn't pick up their phones, and then found a closed office.
What is really interesting for me, Lisa Vetten, is last week we saw Bathabile Dlamini resign as an MP, and she had an interview with Clement Manyatela from EWN News, and she compared the way in which she was treated by sections of the media as someone who was undressed and raped and made to feel naked. I know many people took exception to that analogy and thought it highly, highly inappropriate and highly, highly opportunistic of the minister to do so. Considering that money for survivors of abuse is now simply not available, social development can't account for it, what does one make of the minister who wants to use one of the harshest scourges that we're dealing with in society as an analogy for her not wanting to return to Parliament, with someone who's actually intimately involved in withholding that kind of services and support for women?
The minister was being very melodramatic, and I think simply trying to garner sympathy for herself. But I mean, as you point out, she's not the victim here.
Yes.
She had more than, 8 years in the Department of Social Development to address this, and she did nothing. I think what we see in the TCCs is actually symptomatic of the entire social care services sector as a whole. They live hand-to-mouth existences of 3 months, no money because the department hasn't paid you on time. Money for a few months, then you're out of money again. These problems are perennial. The problems in the TCCs, this is the second time we're now doing this. They've been known about for well over a decade. But you have not seen the Department of Social Development step in and do anything. In fact, you have a situation where the Department of Health, they'll say, you must get funding from the Department of Health because you're working from a health facility. And the Department of Health will say, no, but you're providing a counselling service. You must get funding from DSD. And you know, it's not even expectation on the part of NGOs. These are rights. I think if you look at the rights to emergency health care, rights to psychological integrity, I would argue that post-rape care is a socio-economic right to which rape survivors are entitled. So to sit back and pass the buck and to refuse to take responsibility is actually an abrogation of your duty and a rights violation.
Mia Malan, the relationship with social development has always been a conflictual one. The minister also went on a rave about how she was treated by the media. You do very scrupulous checking up. You phone provinces, you phone departments and so on. I'd like you to sometime try the water and sanitation department. I understand their phones are cut. They're not able to answer the phones because the money is gone since Nomvula Mokonyane spent it all. But how does social development in the provinces fare? If you were to rate them, on a scale of 1 to 10, where are the really bad ones? Where are people trying? Where are people getting off their behinds and looking at what is in their budgets and making it available to people?
So for our story in LSE, we looked at 3 centres, so I can really comment on those 3 provinces, and that was Emalageni in Mpumalanga, Thohoyandou in Limpopo, and Sasolburg in the Free State. Now, the example of the Free State that I mentioned earlier is the director of an NGO phoned, was desperate for funding from the local department, didn't get any answer, then drove to this department, physically went there, and arrived at a closed apartment with a sign that said, "We closed, we have no electricity and water." Now that, I think, speaks a lot to the kind of service you could expect that you would get. And I also think that in both the provincial departments, but also the national department, there's a real lack of planning. This Global Fund money that is changing, they've known about it for 3 years. They've had 3 years to plan for other funding, and nothing has been done. They now act as if they all of a sudden stuck without anything. The Social Development Department in each province and also nationally had 3 years to plan a strategy. These NGOs do not need to be stuck. They know very well these NGOs are very often grassroots NGOs. They don't have the capacity to fundraise, that there would be no services without them, and nothing was done. So to then accuse the media of not working with you, if we try for 2 months to get hold of Lumka Oliphant and she doesn't respond, that's not us victimizing you, that is you simply not responding. And by the way, in 2016 we did a story when we already knew this funding was going to change, and the response from the Social Development Department, the National Department, then was, no, funding is not our responsibility. Our contribution is we give a social worker here and there. Now that speaks of no comprehensive approach and also no understanding of how you would get the money to provide the services.
Lisa, I was looking at you nodding, wanting to come in here. The fact that government is well aware of the dangers of some of the programs, given the changing global environment in terms of funding, that they have the opportunity to actually put together plans, that they have the opportunity to be quite granular about their interventions. Why do you think it's not happening? Is it just a lack of political will? Is it a lack of understanding of what their job actually is in social development? What is the root cause of this don't care attitude?
Social development is very complex, and there are a couple of things that are going on. And different things are going on in different provinces. So I think part of the problem is that when you look at the Department of Social Development, about 90% of the budget goes towards grants. Between 8 to 10% is left for services. Out of that little 8 to 10%, 2% of the total service budget for services goes to victim empowerment. So that's what must go towards service to the TCCs. The provinces are then responsible for distributing it, not national, and they do their own thing. So Northwest, for example, because they've been on strike and under administration, there have been no services in TCCs for about a year now. If you go to Gauteng, for instance, Gauteng does fund the Thuthuzela Care Centres, but they fund those counsellors at rates that are below the minimum wage. So when I was doing my research there, they were paying them 1,250 Rand per month. That
a counsellor.
A counsellor. Now, this is a problem throughout the DSD nationally, is that they pay counsellors below the minimum wage. So when you hear government stand up and speak what a wonderful job it's doing and how progressive the minimum wage is, I'm sorry, please look at the subsidies they give to counsellors. So they pay different things in different provinces. It is about a lack of planning. Some of it is about something else, which is that the Department of Social Development in some provinces wants to get rid of NGO services. In fact, their draft white paper says they want to reclaim and take back the space, despite the fact that they do not have the capacity to do so. And so what some of the departments are doing at regional level is they pay NGOs very badly, they don't pay them on time, they make their lives difficult. They monitor them to death, to the point where the service shuts down or the service gets taken over.
It's actually so weird because my previous conversation was with Dr. Niva Makhetla and Teto Mahlakwani around social compacting. And that is, of course, the golden phrase that defines the Ramaphosa way of doing things, which is that you draw in people, that government can't do things alone. Mia, if that is the approach of the president, why do you have a hostile relationship between civil society and government departments when they should be complementing each other?
Absolutely, and as you mentioned, you can't provide these services without the NGOs. To give you an example of the TCCs, the counsellors didn't just counsel; they were not just the empathetic shoulder. A report that Lisa was actually involved by NACOSA that was released. They provided so much more. Doctors in the report, for instance, said that when they give post-exposure prophylaxis, which is HIV treatment, preventative treatment, so that you don't get infected with HIV if your rapist was HIV positive, it was the counsellors that checked that people took it for an entire month.
Yes.
They were the people that could note who took it, who didn't take it. They were the people that accompany people to the court when their families don't want to go. So it's not even just about the core services, it's about the comprehensiveness that they add to these services. And it's also not just the social development department problem. If you look at the health department, community health workers, which would basically be the equivalent of counsellors for the social development department, have complained for years about NGOs not getting paid on time and them not being able to operate. But I really think if the president makes commitments, then there needs to be someone who's allocated to make sure that this is followed through.
Yeah, and monitored properly.
Yes, because you're dealing with a relatively dysfunctional department and they're not just going to do it.
Now, this dysfunction in the state, like you say, is not confined to social development and to health. But the reason we're focusing on it is because the president has actually said that the face of inequality and poverty in South Africa is that of a black woman. We all know that poverty is feminized. We all know that inequality is feminized. And you've got to start somewhere. You've got to make interventions. I mean, this whole week we've been looking at violence at schools, for example. In most cases, just from a law enforcement perspective, not understanding the context in which this violence actually happens, which is the end result of what you deal with at your end when that rape survivor, that victim who has to come to terms with what happens to them, doesn't have anybody to make sure that they do things. How do you, Lisa, suggest that the task team intervenes in making sure that what is said on paper is actually the lived realities for people who require those services?
I sit on the ministerial task team for universities, not the actual Gender-Based Violence Council. But I mean, so my advice is to that council. I think, that's exactly the point, is there have been numerous exercises in order to cost this. I actually think there's a point where the President does have a responsibility, because if we go back to 2016, Cabinet actually issued an announcement where it said specifically and committed to starting to increase the budget to social care services. It didn't do that. So the President is responsible, even if that was said under Zuma. So I don't think this can be kicked back to DSD. The President has to take it on and ask the provincial departments of social development to account for what they have done. They were actually given extra money last year, over a 3-year period, through National Treasury. The provinces have taken that money and chosen to spend it in different ways. They must be held to account for it. I personally feel that departments of social development should be taken over, the social care services side, and possibly a couple of people replaced, and very stringent reporting and administration put onto them in order to get this problem sorted out. We've lived with it for decades. Those who use services are predominantly poor black women. Those who are providing services at below minimum wage rates are poor black women. So government must please stand up and actually commit itself to what it puts out there. And I think the President in SONA, I would like to see him say something to that effect, that he has personally taken an interest. There's been no social sector summit, as was promised, to look at some of these issues. It needs to happen. He needs to sit and listen to NGOs about what is happening. And I think to give them some assurances to whether or not the department is simply going to push them out when they cannot take over, and there isn't the money for them to take over, and therefore to simply deprive women of even the few services that they do have. So I am looking forward to his SONA and to seeing what he's going to say.
Mia, is it necessary for us to look through SONA, through the budget, more importantly also through a gendered perspective? Because if you don't cost something, you can't measure it, and you can't then tell whether you've got outcomes. Lisa's just indicated that there's already been transgressions of what was promised, that we need the President to actually engage with women on the issues that faces them, and ensure that we don't just talk about a war on crime and a war on rape, but the very services that you need for people to just survive from one day to the next after having been through such an ordeal is actually realized.
Absolutely, and the President has engaged politically, but that political commitment needs to filter through. And when you say a gendered perspective, I think added to what Lisa has said is that all the research shows us that if you don't address the consequences of violence, particularly gender-based violence, it becomes a cycle of violence. Almost all men who have raped or who have been violent, a very high percentage of them experience violence as children as well. So you then create an even worse environment for the face of poverty in South Africa, black women. So by not addressing this and by not being very conscious of what it would cost doing a budget. We have similar issues with the NHI, right, that doesn't have a budget. You would not be able to measure it, and you would not be able to break that cycle of violence.
Now, this cycle of violence, it's engulfing our society. People talk about crime all the time. People want to understand why a 15-year-old kills another 15-year-old, why a 9-year-old stabs his sister's or his girlfriend's brother to death, and so on. So there's drivers of violence in our society, obviously. A lot of these services try and address some of this. They prevent, they also provide places of safety for women and so on. If these services are not provided by social development, where else ought they to be housed? Should they, for example, be housed in the presidency through the the minister in the president's office, who is responsible for monitoring and implementation? Should it go to the women's ministry? Where will it be better placed so that it's better monitored and so that people actually get better results, better services?
To be honest, I actually think they should take the whole grants section of the Department of Social Development away from social development and create another structure that pays out all grants, unemployment insurance, workers' compensation, etc., so that social development can focus on services. And then we could actually start to see what the budget is and start to agitate around how little it is, because that's disguised by how much is going to grants. So I would put it there. I would also pick a minister. I mean, with all due respect to Lindiwe Zulu, she may have been very good in small business, but that doesn't equip her to run something like social care services. I would like to see ministers, HODs and DGs who come out of the sector, who understand the issues and who will pay attention to it. That's the first thing. These problems are also deep-seated. It's very interesting to read historically, back in the 80s and the 90s already, the treasuries of that time saying that the Department of Social Welfare lacked the capacity to cost and plan. Here we are, seeing it carry through 30 and 40 years later. Now, in the case of the TCCs, they're costed. Through Global Fund, we know what they cost. Not difficult. Shelters, there have also been attempts to cost those. We can show that more than half of women who go to shelters do not go back to their partners. You are reducing violence. That's not trickling through into the day-to-day planning. So I would really look at how do we restructure the Department of Social Development in order to put in place people who can cost, who can look at outputs, who can understand services. And while social workers are important, I don't think they need to be working with people who can work within an economics background as well as within the actual social planning side.
Yes.
And we can actually see we want a 5-year plan. The Department of Social Development has been fussing around with the Victim Empowerment Social Services Bill since 2011. They have been promising a new financing policy since 2011. They've had a draft shelter policy since 2013 that lapsed in 2018. So you have a department that doesn't have policy, whose policy is allowed to stagnate. So you need some...
So what happens to that money, Mia? Does that money just roll over in budgetary terms? Does it just get returned to the department? What happens to that money that's not spent?
I'm not exactly sure what happens to it, but what I can say is that we have done several stories about various departments claiming not having money on a provincial level, and then comes the end of the financial year and the budget is unspent. So that there's not even a capacity to spend the little money that there is. Lisa would perhaps know better about does it get returned or what
Guys,
happens.
I'm going to have you back after we look at the budget, because I want to look at the budget through a gendered perspective, because as you say, if it's not costed, it's not planned, and it cannot be monitored and accounted for. Lisa Vetten, Mia Malan, thank you so very much. Still ahead on The Fix, we take a look at the stories making headlines on your weekend newspapers. Don't go anywhere.